Hello and welcome. My name is Michele Toplitz, and I am the Program Director of the National Academy of Medicine's Initiative on Transforming Systems for Climate and Health. On behalf of the NAM team and our Global Commission, thank you for joining us for our second information gathering workshop, this time focused on the how of systems transformation, strategies and levers for health-centered climate action. We're joined today by participants from every region of the world, representing a wide range of disciplines, sectors, and lived experiences. While we may be logging in from different places and perspectives, we're united by a shared purpose to better align climate and health action and to explore how systems can be reoriented to serve both people and planet more effectively. Next slide, please. Before we begin today's program, a few quick housekeeping items. Today's session is being recorded, and the video and presentation materials will be shared on the NAM website following today's event. In addition to the insights shared by our speakers, we hope you, the audience, will actively contribute your questions and reflections to help shape the direction of this work. To do so, we encourage you to use Slido, our live Q&A platform. It's simple to access. Just enter your name, check the box, and click Join Slido. Once in, the blue bar below the video player will give you access to submit questions and view others' questions. Each session today has time set aside for Q&A, and we'll aim to address questions as time allows. Next slide, please. I also want to take a brief moment to extend my sincere thanks to our planning committee for their thought partnership and leadership in shaping today's agenda. This event and the rich conversations we'll have today and again in August would not have been possible without their time, creativity, and commitment. So thank you very much. Next slide. And with that, I am now very pleased to turn things over to the chair of the NAM's Climate Grand Challenge and co-chair of this initiative, Dr. Judith Rodin, who will share more about today's program. Judy, over to you.
Great. Thank you so much, Michele, and welcome to everyone. I'm delighted to see you. Am I on the camera? Yep. Okay. It's good morning for me, but for many of you, good afternoon and even good evening. And so, as Michele said, we're so delighted to welcome people from all over the world to this very important conversation. We're beginning again in this workshop to continue our critical journey toward health-centered climate action. And I want to thank you all for joining the workshop. This one is on the how of systems transformation, and I'll go back and talk just a little bit about our first workshop last April, where we asked an initial and quite fundamental question, and that is, what does systems transformation mean in the context of climate and health? That workshop in April marked the beginning of the Commission's collective inquiry. And what emerged was both clarifying and challenging. And this is so important to stipulate. That workshop actually concluded that our current systems, whether they're economic or political or social, aren't broken. In many ways, they're functioning precisely as they were designed. But those designs themselves are no longer serving us. They reinforce short-term gains at the expense of health and well-being, and they often actually entrench harm, especially for the most vulnerable among us. From those discussions, 5 core themes emerged. May I have the next slide, please? These themes, and I'll elaborate each of them, are first, that systems change. Oh, I guess I don't need that slide yet for the objectives. I'm sorry. Can we put that off? I apologize. Systems change is not a matter of simply tweaking around the edges. We need to create the conditions for entirely new systems to emerge. We need new incentives, new feedback loops, and even new norms, ones that reinforce health and well-being for both people and the planet. Second, narratives matter. If we want different outcomes, we actually have to tell a different story, one that defines progress in different ways, redefines things beyond GDP, challenges extractive models, and taps into values of care and equity and shared prosperity. Third, what we measure signals what we value. We heard a very strong call to shift towards metrics and incentives that align with longer term and equitable health outcomes, not just emissions reduction or even economic output alone. Fourth, true transformation will not happen in silos. It requires deliberate coordination across both sectors and scales, from the local to the global, from civil society to finance ministries to C-suites. And finally, none of this matters without implementation. Knowledge and ambition are terrific and they're terribly important, but they must be matched with delivery systems, with institutions, accountability mechanisms, and financial pathways that can turn vision into sustained action. And that brings us, of course, to today's conversation. How can this type of systems transformation happen? Now I'll take the slide, please. Over the course of this three-part workshop series, which is today and again August 5th and 6th, we'll examine what it actually takes to catalyze and sustain systems transformation. We'll be guided by 4 overarching objectives that apply across all 3 days. First, to identify the structural levers that are most critical to accelerating health-centered climate action. We want to understand deeply how these levers interact, how they will enable systems transformation. Second, we will examine the actual enabling conditions that influence the feasibility and impact of these levers across diverse contexts and diverse sectors. Third, we will distill real-world strategies and actions that have successfully mobilized these levers. We'll learn through this workshop what made them effective and who and what helped them to gain traction. And fourth, we'll be surfacing the barriers because it's critical to understand them and the trade-offs, as well as the synergies and tipping points that shape systems transformation. We'll explore the strategies that will help decision makers navigate this complexity. With these goals in mind, let's briefly walk through today's agenda. May I have the next slide, please? We've had the welcome and opening remarks. I hope you all feel quite welcome. We're very excited to have you. We will, in session 1, ground ourselves in the Commission's current working assumptions, the Commission's mental model of systems transformation. We've spent time on this, a great deal of time already, but our goal today with session 1 is to collectively interrogate and evolve the thinking that's developed so far. We want your help in sharpening how we define levers, how we think about systems change, and where we see new opportunities for catalytic climate health action. In session 2, we will turn our attention to metrics, not just how we track progress, but obviously metrics begin with how we define success in the first place, and how our measurement systems can help ensure that we're not only acting, but that we're transforming. And finally, session 3 will examine the role of culture, narrative, and behavior. These are actually often the quiet forces behind systemic change. They shift what societies value, what they see as possible, and when they see the momentum tipping. We'll ask, how can changes in social norms and belief systems unlock new opportunity windows for climate and health action? So with that, I'm excited to jump into these conversations, and I'll turn it over to my fellow co-chair, Dr. Andrew Haines, to kick off session 1. Andy, over to you.
Thanks, Judy, for giving us a great start, a great introduction. And it's a great pleasure for me to add my words of welcome to you all. As you already heard, the Commission has set itself a very ambitious task, but a very necessary one. And it's focusing on 3 particular areas: the implementation of transformative change to put health at the center of a sustainable economy, which can support people and planet; sharing a preliminary mental model of the kind of approach that we think is necessary, and getting your feedback on it; and accepting that this is very much an idea-generating session. So we don't come with prefixed ideas. We're very much open to suggestions, to the visions that you may bring to this very important discussion and debate. And we're looking forward to hearing from our two discussants. Sadly, Agnes Binagwaho, who was going to join us, cannot be with us today, but we have two outstanding discussants, and I'm sure will bring their own very powerful views to the table today. Let me ask now to share the first slide, please, on the mental model. So we are aiming to develop this shared mental model, and I want to just share a few preliminary thoughts about what that might constitute. Next slide, please, Noah. And that model comprises of a number of different themes. One is the importance of health-centered climate action. So it's an approach to climate mitigation and adaptation. And by the way, we see both of those actions as being absolutely essential. But rather than considering them in completely separate silos, as often happens in contemporary policy making, we see them as being a kind of integrated spectrum of actions that need to be implemented at scale. So adaptation at the one end of the spectrum is focused on how we adapt to the changes that we cannot prevent, that we're already we're witnessing in many parts of the world already, including extreme heat, floods, droughts, changes in infectious disease distribution, and so on. And mitigation, of course, focuses very much on cutting greenhouse gas emissions. And greenhouse gas emissions, I mean, CO2 is obviously a long-acting greenhouse gas, but others as well, the so-called super pollutants, particularly some of the short-lived climate pollutants like methane, for example, which stays up in the atmosphere for only 12 years. And so, therefore, when we cut the short-lived climate pollutants, we can have a very rapid effect on climate change. But of course, climate mitigation action also brings with it a range of co-benefits, ancillary benefits, for example, from reduced air pollution, from burning less fossil fuels, improved health from more sustainable dietary choices, increased physical activity from more sustainable transport systems, and so on. So we see this health-centered climate action as a theme that really focuses on the prioritization of human health, well-being, and equity as core outcomes, and also as drivers of systemic change across sectors and systems. And we don't seek in any way to diminish the importance of the healthcare sector, which contributes globally to perhaps 5% of emissions, but in the US it's considerably more than that. And the healthcare sector can do a great deal, both to reduce its own environmental footprint, to be more resilient to the climate change that we're witnessing, but also to have an impact on a range of other sectors. And it's those other sectors that we're focusing on particularly today. Energy, of course, food and agriculture, transport I've mentioned, industry, waste, the built environment, and so on. So we're aiming for systems transformation, which essentially is a fundamental reconfiguration of how these interconnected systems that have driven our economic growth today, unfortunately unsustainable economic growth, how these systems are structured, governed, and resourced, as well as how they interact. And so we'll be examining those interactions in some detail during the course of our work. And we see systems as interconnected sets of actors, institutions, infrastructure, behaviors, rules, and regulations that produce outcomes over time. And of course, depending on the outcomes you prioritize, you can get very different results, and you can end up with very different system configurations. And we are very clear that the outcomes that we are prioritizing are the achievement of health and equity at net zero emissions in the future, and a much more resilient healthcare and intersectoral action than we currently have. And of course, sectors we understand are distinct domains of economic and social activity, and I've mentioned many of them already. I want to also emphasize the importance of the finance sector, because the provision of adequate finance will be absolutely crucial for the implementation of change at scale. And one of the challenges is not necessarily just a lack of finance. Often there's sufficient finance, but it may not be directed to the goals that we think are particularly salient to the work that we are planning. And of course, I also want to point to the importance of cities. because cities are largely the places where population growth is occurring around the planet. More than 50% of the world's population lives in cities, and that trend is likely to increase in the future. So cities are responsible for about 70% of greenhouse gas emissions, and the policies in cities, either to adapt to or to mitigate climate change, will be crucial determinants of the future of humanity. Could I have the next slide, please? So we're currently faced with a situation where climate change is manifestly accelerating the threats to our health, and we're increasingly able to quantify those. It is true that much of the historical literature has not formally attributed the health effects to climate change itself, but that is now increasingly possible. The methodology has improved dramatically in recent years, and we're now able to formally attribute these health outcomes to human-induced climate change, both in terms of extreme events like heat waves and so on, but also gradual trends, gradual changes in temperature and precipitation and so on. So the problem we have at the moment is that although our knowledge is expanding, increasing, systems are compounding the threats that confront humanity and are undermining many of the natural systems on which our civilization is based. And currently we're seeing many decision makers either ignoring these threats or sometimes even actually trying to failing to counteract these threats. So that, I think, is a real challenge, and it's something we will need to consider as we move forward with the Commission. Next slide, please. So what we're aiming for is to articulate a vision towards a global shift to net zero that overcomes the fragmentation of policies that we so often see at the moment, moves towards integrated system-wide approaches that place health, equity and well-being at the centre of our vision. Of course, ensuring that we focus not just on financial capital, but also human and natural capital as well. And of course, natural capital being that which is so essential for underpinning human progress, but is often neglected in policies. So what we're aiming for then is health for all and net zero emissions over time. And this is the bold vision that we have and we wish to articulate. And today's session will help us to start that discussion, to build on what we've already heard, and to articulate a way forward. Next slide, please. So our assumptions in carrying this work forward is that health is not just an outcome of these policies and systems change, but it also can be a driver for change. And that is because people across different cultures, different societies value health. They value their own health, and they value the health of their nearest and dearest, of their loved ones, and those that come after them. So health is, one might say, an almost universal value. And that's one of the reasons why we believe that this Commission does have the potential to articulate solutions that could be appeal to a wide range of cultures and societies across a wide range of political beliefs as well. We also acknowledge that the levers for change are largely outside the healthcare sector. And as I've said, I don't want to underestimate the importance of healthcare. Of course, healthcare is absolutely essential for achieving health for all. And healthcare can play a very important role in creating more resilient society, but also moving us towards a net zero carbon agenda. But as I've already said, many of the determinants for health, and many of the policies that we need to implement to improve adaptation and mitigation lie outside the healthcare sector. And that has very important implications for health professionals, because it means that we need to work with other disciplines and other professions and other sectors in order to accelerate this ambitious agenda. And that's why I think reaching out to other sectors and other disciplines will be such an important and innovative part of the work of this Commission. And as I've already mentioned, solutions must be integrated, not siloed. And that is because policies in one sector may be necessary, but not sufficient for change. And also, unless policies are implemented across a range of sectors, then we won't see the change at the necessary speed and scale to achieve these ambitious outcomes. But at the same time, it's important to acknowledge that there's no one size fits all. So context matters. You can't tell people around the world how they should live and how they should act, because the solutions will be very much need to be tailored to the local environment, the local context. And those solutions cannot be just imposed top down. They must also be bottom up and co-designed with communities and with key decision makers. So our vision is one of an enabling future, which enables decision makers to make the right decisions, but also to engage communities, to engage a range of different interest holders, interested parties that can contribute their own creativity to this process. We also acknowledge that trade-offs are almost inevitable, as they are in any policy. So it's important to understand winners and losers, and not all policies, or many policies, may not result in winners across all social groups or all economic sectors. But it's important to make these trade-offs visible, to take them into account, to minimize them where that's possible, and to seek synergies between policies that will enable us to capitalize on the multiple benefits that well-designed and well-implemented policies can bring to humanity and to the natural systems which underpin our society. So I think that's the last slide, Noah. Is that that's it? Yeah. So let me move on now to introducing our two discussants, and it's a great pleasure for me to do that. I'd like to introduce Arunabha Ghosh, who's the founder and CEO of the Council on Energy, Environment and Water in India, and Beth Sawin, who's the founder and director of Multisolving Institute in the US. Both of them are very well equipped, I think, to help us on this path, because they both bring both innovation, creativity, but also a very broad vision to this agenda, which is exactly what we need. So in asking them to say a few words to kick off the discussion, I would like them to consider how do the mental model, the outline of which I briefly referred to, resonate with your experience in driving systems change. What blind spots or tensions should the Commission account for as it develops its strategic approach? And where might this model be most useful or most limited in guiding real-world decision-making? But feel free also to make points of your own. So let me start with you, Arunabha, and hand over to you for your remarks. Thank you.
Thank you, Professor Haines, and very nice to be included in this conversation. So thank you very much for inviting me. And thanks for the presentation. I think you wanted an initial set of very quick remarks before we dive into the deeper conversation. I'm looking forward to what Elizabeth has to say. So let me simply start by responding to your first two questions on, how this framing resonates with me. First of all, I think you're all obviously onto something and trying to use healthcare or health more broadly as both a driver and an outcome. And I think this is absolutely critical because of many of the things that subsequently follow, whether it's the co-benefits point, the cross-sector levers. But I see this particularly important from if I wear an economics hat and I ask myself, who's your audience? And you do have a framing of your audience of various policymakers, et cetera. But it depends where that policymaker is sitting. If you address this to the health policymaker, this might seem obvious. But this is where the work of the Commission will become particularly important. If you're trying to address this to an environment policymaker, but even more importantly, if you're trying to address this to a financial policymaker, the one who controls the purse strings. So I think while health is an important entry point to demonstrate that it as a driver can actually help you on the financial side of things, given that countries have limited public finances, there's a debt crisis across the world, et cetera. So I think this is why this driver and an outcome framing is extremely important. Just as an example, my organization, CEW, we've been developing this very detailed, granular heat and humidity action plans at a neighborhood by neighborhood level across dozens of cities. Eventually, we want to do it for 300 cities. But what's important here is not just how we integrate heat, health, early warning into your kind of city health plans, but also how that framing helps to design cities better, improve green cover, improve the quality of outdoor spaces, especially for outdoor laborers, etc. So your equity dimension also comes in. A second quick thing that I wanted to mention is about these cross-sector levers. Now, there's policy is one thing. Policy without a budget is something completely different. And this is why I think finding avenues where there is not just co-benefit in the outcomes, but an integration and a coherence in the line items that are presented in the budgets. So there, you're not just pulling away from some other sector's budget and injecting it into the health ministry's budget, but trying to bring some coherence in those policies. That's, I think, very critical. And that's where your cross-sector levers will matter. A third important way it resonates, of course, is then the co-benefits, especially when we combine the Sustainable Development Goal on health with the Sustainable Development Goal on energy, and of course, combine it with Goal 13 on climate. And I think the framing of resilience here would be particularly important. We almost always think of resilience as after the fact, when a disaster strikes, etc. But that's against the acute stress. But the healthcare challenges that are chronic in nature, and that then get, as you were saying, compounded by a worsening climate, allows us to actually think about co-benefits and resilience as an upfront outcome that would help us to plan and prepare better. I think one, and I know I'm out of time for this initial round, one quick blind spot I would like to address is, at least from the part of the world I come from, I guess I've worked across many dozens of developing countries. There's a big gap between policy and implementation, even if it were funded. And I think if the Commission can draw on examples where greater decentralization, not just of the final implementation of a policy, but also the ownership and the final policy implementation design, that would help you to bring in the frontline workers into the design phase rather than have them as recipients of your well-intentioned initiatives. Let me stop there. There are many, many more things I could add, but let's hear from Elizabeth and then take the conversation forward. Thank you.
Thank you so much, Arunabha. I think it's a wonderful, overview of the challenges and some of the solutions, and I think it hopefully will segue very well into what Beth wants to say as well. Over to you.
Yeah, thank you for the invitation to share a little bit, and I resonate a lot with your thoughts, Dr. Ghosh. I thought I would answer actually by telling you a little bit of my journey in this same set of questions, because where you are very much resonates, but also there are a few points of departure. I would like to start in actually 2009 in the line for coffee at the Copenhagen COP, where I was a climate modeler, giving UN negotiating parties kind of a mirror of where their pledges would lead. And the answer was there was a big gap, as you all know. And I was in line behind the negotiator from Costa Rica, Cristiana Figueres, who you all know came on to be the genius behind the Paris COP. And I asked her, pretty naive and innocent, what could we add to our climate models that would unlock more movement at the level of the COP? And she basically said, we negotiators go as far as we can until our president or our prime minister will lose the next election. And, the Copenhagen outcome was disappointing. I was disappointed. I went home to young children. And that stuck with me, that within that space at that time, the carbon-centric framing had all of this as a cost to societies. So I hired a researcher and I said, what would get better if the world got off of fossil fuels? She was the best researcher I knew. 2009, she brought me back a report and said the costs of getting off of fossil fuels would be balanced at least by the benefits across jobs and health and economics. And this gives you a sense of my mindset. 2009, I asked her to check her math. I said, I thought there was a decimal point in the wrong place, because I was, and everyone was, so much in the frame of climate change is something we need to sacrifice in order to address. So I finally believed her, and that changed all my research, all my work. And ever since, I've been on this quest for how can societies find these synergies. For a long time, I thought it was about just sharing the data and evidence. I don't think that's enough, and I'm glad to hear you all talking about policy and enabling conditions. Then I thought it was entirely about policy, and of course that's part of it. But what I have come to believe is that our societies are simply not structured to find these synergies, and where decisions are taken don't have the right people involved. And that actually I think the biggest missing link is relationships that span sectors. And when you all are acknowledging, and I'm really happy to hear you're talking about context and how the nature of solutions is different in every place, I really agree with that. And so in our work, and the last thing I'll say about our work is that we've really focused on identifying bright spots where these synergies have been realized. And what we can say from looking around the world at all scales and all types of sectors is that there isn't one roadmap, and I don't believe there is one set of policies. What there is a way of being together, a set of prioritization of relationships, of centering equity, of taking the time it takes to build connections across silos to help societies realize what's possible. So when I think about your powerful commission, your high level sort of ability to capture attention, I would love to imagine how that could be used to create the conditions for those relationships to form, and to think less about you all needing to come up with the advice and the frameworks and the answers, and more, how can you take leaders in a city or in a nation or a region across these sectors and give them what they lack, which is the time to be together, the mandate to think together. If you could give them that and a modest budget, the amount of time it takes in money to convene people relative to the savings that are unlocked is a multiplier of tens, if not hundreds, of that size of a gain. So that's where I would direct your curiosity and see if it holds up for you. And the very last thought I would add is just the other part of unlocking these synergies, and I don't know the answer, is the financing mechanism for the time dynamics of this. Because while it is true, if you add up the health savings and the transition costs, you can't really build solar panels with the money you're going to someday save by fewer children having asthma. And I don't think that's been unlocked yet, and is a real contribution if your work could advance that. So thank you.
Well, thanks very much, Beth. Again, some wonderful reflections there. I think would really help to stimulate discussion and debate. So let me just sort of build on a little bit of what you said, and I'll go first to Arunabha. And I want to just, I think you very clearly made the point that health can be a useful entry point, but of course what I'd just like to your views of what are the kind of strengths and weaknesses, and what do we need to be aware of when we focus very much on health, because obviously our focus, we come from public health, healthcare sectors, so our focus very much on health, and that can sometimes lead to myopia. You already mentioned the important point about how you can communicate to the finance sector, and Beth also made that point that sometimes it's difficult to link up in temporal scales, and sometimes the magnitude as well, the magnitude of the benefits, financial benefits, and the immediate expenditure. So I wonder if you could just maybe expand on some of the points that you made, just to give us a slightly fuller picture of your views.
Sure. Let me try and address that question picking up a little bit on what Elizabeth was saying, see, one of the fallacies we tend to make in our technocratic worlds, and it's not just if you're a public health professional or someone else, is that we think that the data is sufficient for rational action. And therefore, we approach these things from our respective perspectives, how many lives could have been saved, and therefore, of course, the policymakers should act and so forth. But in reality, that doesn't pan out. Now, how do we convert that information into something that is actionable? I think Elizabeth was also kind of hinting at that. One idea is that point about the savings in future infrastructure build out, et cetera, because you've avoided certain costs up front. But if that is not within the political cycle, again, the point that Elizabeth was making in reference to Christiana's comment, then all you're doing is you're demonstrating an equation that does not have political salience, unless that same politician wins a second term or a third term and says, oh yeah, now I see over a 10-year period, my upfront savings prevent certain costs. So I think one of the things that is necessary here is to look very much at a prioritization of the lower hanging fruit. And in the climate space, however, that is where things become a little challenging, because what is a lower hanging fruit from an emissions perspective might not necessarily be a lower hanging fruit from an equity perspective, might not necessarily be the lowest hanging fruit from a public health perspective. If I really only wanted to reduce emissions, I would just go find the largest lot of desert land that's unused and stick install solar panels there. That doesn't actually change overnight the healthcare outcomes or the put an equity lens on what kind of heat health resilience you're building for poorer communities in a city. So I think where this prioritization needs to come from is once you have your list of recommendations, so your laundry list of 20 things that could be done, then perhaps the commission should engage with intention and not assumption, policymakers and political leaders in different parts of the world. What resonates with you in these recommendations? What would you pick up on? Rather than you kind of throw out those recommendations and assume that they get picked up. So that's one thing I thought I would add to this. The second is, and this is one of your assumptions, and you mentioned it right towards the end of your presentation, that make the trade-offs explicit and visible. And I think that is absolutely correct, because we have now entered the world where the easy stuff is kind of done, and we are already, of course, breaching many of the environmental boundaries that are dangerous for us. So if we keep emphasizing, on one hand, yes, Copenhagen felt like it's cost and not benefits, but equally there is a danger, and that has been seen in certain political economies, that politicians are now nervous about saying that there's any cost at all. So, everything is great. Renewables is great, and it's great for public health, and it's great for the economy, etc. But it's not great in the immediate term. There are winners and losers who need to be compensated. If you don't do that, there is political backlash. And I think it would be useful if, again, there were a way in which the Commission ranks some of those outright contradictions that might emerge, and then tests it out. How do you resolve those contradictions? I liked that you did not mention the phrase vested interest, and you said something along those with interest. And that's right. If I have an interest in something, yes, I'm obviously vested in it, but vested interest suggests I am doing something bad, I am negative, and you're great. I think we've got to remove these subconscious biases and prejudices we have to have the broader conversations with society at large that are currently missing, and which is why we're not getting the political sustainability for sustainability.
Well, thanks so much. And maybe we'll come back to this point about compensating the losers, because that's an important question, whether all losers should be compensated, and if so, how, and how would one estimate that? And to what extent are there kind of responsibilities that need to be taken into account? And there are a number of other issues like mis and disinformation, which can cloud the picture and make it very difficult to assign responsibility for say emissions or for certain outcomes, something we'll probably come back to in the discussion. But Beth, maybe I can come back to you and really focus on whether you can share your experience about a particular belief or mindset that holds institutions back from really advancing more integrated, coherent solutions, which encompass health, but of course are not just limited to health. And I wonder if you could share your reflections on that from your experience.
Well, one I would start with and plant the seed for further discussion in your commission is whether centering health might just be replicating the same type of silo behavior that you see as an obstacle. In our work, we actually don't anymore use the term co-benefits. We started adopting it from the wider field, and it was direct experience with people like a parent of a child in the emergency room with asthma. You're talking about shutting down a polluting power source. For them, the climate is not the main benefit, and air quality a nice to have co-benefit. And so I think if we want to move in this different way, we need to start with what in our work we call solidarity, which is showing up for the other interests that these win-win-win solutions can advance. That's to say climate isn't the right thing to center, and I don't think health is either. I think what is to be celebrated are those opportunities where all of those causes can rise together. So that's one thing I would say. I think in terms of what might be holding progress back, I think I would name two things. One is not acknowledging the level of destabilization that the world is in at this point. So I would be very cautious about designing any plans with too much of a long time horizon of we're going to do this and then that, because I think we've moved out of that era. I think there are things to do, and I could say, if not those long-term plans and frameworks, what? But I would be pretty cautious and acknowledge that you all are going to be affected by destabilization as much as the governments and communities that you want to support, in my belief. And I think the last obstacle I would name, and I hope this isn't too controversial, we're all have careers as experts on this call, but I think it's time to set the role of expert aside and think about what would it mean to facilitate the types of connections that would enable nations, states, provinces, cities, neighborhoods to find these synergies on their own. And from our work, we believe some of those conditions are establishing shared values and shared visions, building capacity for systems thinking so that everyone can see the whole, investing so that people have the time to find these connections. One of the biggest obstacles, you talked about barriers, I'm glad you acknowledged them, is just people's ability to talk with someone in another department, another ministry. It's not part of their job description. The deeper we get into emergency, the harder it is for people to slow down and think together. But I think it's the only way out. So providing those pockets of space for connection and solidarity, I think could be a huge contribution.
Well, thank you so much. Really, I think we've had very rich suggestions from you both, and it's been, I think, extremely productive for us as members of the Commission to get this kind of steer from you. Just one very quick response to the point you made, Beth, about, is there a danger that health itself just becomes a kind of silo? And I suppose what we've tried to do is not to focus on health care, because I totally agree that health care would become a silo, but we're trying to focus more on health, partly because that's our expertise, I suppose, which is a danger in its own right, but also because we do see it as a relatively, maybe not absolutely, but relatively universal kind of value. That most cultures, most societies, most individuals value their health and the health of at least their loved ones and the people that they identify with. Maybe not the whole of society, but some cultures also value that as well.
Can I just maybe clarify just one thing about that? I don't mean to disparage the role of expert or expertise. In fact, what we talk about is a particular kind of expert, the one who is curious about how their expertise connects to others. And I think your stance as a commission seems to be embodying that. So just to clarify, in no way do I think you should walk away from your core knowledge, but that stance of curiosity and how health might advance other goals, I think is a sweet spot. And I don't think we should assume that there is this universal value of health and that's very solid. I mean, if we're going to talk about equity and historic and ongoing injustice, not everyone's health matters in my society right now and around the world. So I'm glad to see you emphasizing equity, and I hope you keep that strong in your thinking.
Can I also come in?
Yes, please.
Because there's a very important discussion, and I think this goes back to the audience. This very last point that Beth made, that let's not assume that everyone is valuing. I think there's also a difference between what people might be valuing versus what they are willing to contribute towards or sacrifice towards. So if you ask me as an individual, do you value your health? I'll say yes. Are you willing to pay, I don't know, 1,000 rupees more in taxes so that your and everyone else's health benefits? I might or might not say yes. So I think the audience here actually now goes even beyond the finance ministry to actually the citizens. And so it is evident from across the developing world, at least, and perhaps many parts of the developed world as well, where public health systems are increasingly privatized, is that when it comes to the individual household, people are actually spending a lot more. And in fact, expenditure on healthcare is one of the drivers of pushing people below the poverty line. Now, that is a proxy for how much they are valuing their own health. That is not a proxy for how much they might be willing to contribute to the public purse so that the overall health system improves. But I think that outreach needs to go to people at large as well, that your outlay from your pocket would reduce if the overall public health system improved, and improved in the context of a compounding climate crisis. And that builds up then the bottom-up pressure for how then the finance ministry official or the environment ministry official integrates public health thinking in their interventions.
Yeah, thanks. That's a really great point. And I think the fact that the climate crisis may actually increase the argument for kind of risk pooling and for public funding. And it's in everyone's interest. Even fairly wealthy people can be bankrupted by a very expensive, surgery or something. So I think we do need to revisit this argument about universal health coverage and financing in the light of the climate crisis. I think it's a great point, and one that we shouldn't lose sight of. Now, I think we're approaching that point in the program when we can also invite other questions. I have a number myself, but I think I'll kind of throw it open a bit too. And I see that Joita has got a hand up. Are those going to be in writing, or how are we going to handle those? Yeah. So Joita, have you put yours in writing? Yeah, great. So Does someone want to read out Joyce's question then? I'm not sure.
I haven't put it in writing yet, sorry.
Oh, okay. Fine. So have we got some questions in writing, or shall we carry on this discussion?
You can carry on the discussion. We'll let you know when questions come in.
Yeah, okay. If you collect the questions, then we'll carry on. So I wanted to raise a couple of points, really. One is we haven't, I mentioned mis and disinformation, but I think it's becoming really center stage now, because what we're seeing is really industrial scale a lot of it's very purposive misinformation, and that is clouding the whole public understanding of climate change, and to some extent also it affects health as well, our perceptions of health, what makes health better, what makes it worse. So I'd like to ask you both, both Arunabha and Beth, whether you have any particular views about how we should tackle this burgeoning, and I think I'll call it a pandemic, of mis and perhaps disinformation as well. So do you have any particular perspectives on this? Do you consider it to be an important factor? And if so, how should we tackle it in broad terms in the Commission? I don't know who'd like to go
Yeah,
first.
I could start. I think it's a huge factor. It worries me a great deal. It's also a little outside my area of expertise. But I can tell you a few things that where we're putting our energy given this. One is actually a project I hope will start soon, which is going to communities themselves with questions about how they're navigating destabilization, one of them being the loss of data or the distortion of data. There's other questions we have too. So that tends to be our approach, is to go and ask what's happening and what's working and try to extract ideas we can share, extract or co-develop ideas that we can share from that. The second thing, and this is again that stance of on the ground, people often know what they need. So far, we've developed only one tool for multi-solving. It's an app. It's called Flower, and it's an acronym that stands for Facilitating Long-Term Whole System Equity-Based Reflection, which is a mouthful, but it actually looks like a flower, and it allows people to name the multiple benefits of interest and to create a visualization for any action that they could take together, which benefits increase, which ones might be burdens. It has a way to graphically show what the equity implications would be, either improving or decreasing. But it's a non-quantitative tool, and it doesn't rely on any expert data set anywhere. What it is a reason for people to come together and build shared mental models, just like you're doing in this process. So I think that actually going to people's lived experience is one opportunity.
Yeah,
I would say that the disinformation problem is obviously much larger and impacting us all in the work that we do. But even within the, say, climate and health interface, the misinformation problem is something that is frustratingly not overcome yet. I'll just give two examples that we struggle with. For instance, air pollution and heat. Right? It is incredible how much misinformation there is about air pollution is something that you could you can build your immunity against, or heat is something that you anyway suffer from in the tropics. So if you're just kind of keeling over and dying of a heat stroke, maybe you're just not resilient enough. And I think that these are not, I don't intend to say these things in jest, but when we are able to convert this misinformation into better directed information to citizens, I think it can create the democratic demand for more resilient health systems. And that's not necessarily a kind of a battle against a much bigger evil of disinformation. It's just we've not done a very good job of conveying the science.
Great. No, these are important points. And just come back to the point I made in the introduction about attribution. And part of the problem is that the health and the climate communities have not been very good about actually attributing particular health outcomes to human-induced climate change and distinguishing between natural variability and exposure to heat that we've had over millennia with what's happening today. And that is changing very, very rapidly. And so we're going to see in the next couple of years a massive increase in the number of attribution studies that will come up with numbers and say X% of people who died in this heat wave died because of human-induced climate change. I think, maybe that's naive to think that that will shift the public discourse, but it will, I think, certainly make it much clearer to the broader scientific and policy communities, and hopefully to the public as well, that climate change is having a measurable impact now. So there may be some scientific developments which can at least assist, and I'm not saying that they're a solution, but at least can assist in all this. The other area that we and others are working very hard on is actually to rapid syntheses of evidence, because you can't just use a single study. You have to synthesize the best available evidence. And we haven't been very good about doing that either in research. And we're now working towards much more effective approaches for synthesizing the best available evidence, but also calling out poor quality or low confidence evidence. And I'm afraid there's a lot of that around as well. And so the scientific community also needs to get its own house in order and actually improve the quality of the evidence and the confidence that we have in the evidence that we're generating. So that's a quick response there. But there are a few questions in the chat which I'd like to come to. One was about co-benefits from Joyita, and this wanting really clarification from you, Beth, about the point you made and co-benefits. I mean, I have my own views on that because we're moving away a bit from the co-benefit term, talking about multiple benefits. But I'd like your response to the question that Joyita's raised in the chat.
Can you read the question? Or
she said she didn't quite get the what you were saying about co-benefits.
Oh, just to kind of reiterate that.
Yeah, because I would take co-benefits to include multiple benefits.
Yeah, why don't you say, Joy, to come in yourself? Yeah.
I would say that even if you would start with climate or health to work out and map the co-benefits, you're not doing it only in two fields, but you would try and cover as many fields, and you would try to take equity also into account. And then at the end, you would try to balance all of them to see what would be the best strategy, depending on who you're talking to. So your rejection of co-benefits was not entirely clear to me.
Yeah, and it's possible that the word doesn't trigger the same reaction everywhere. I'm sure that's true. We just had repeated experiences, particularly with marginalized communities in the US, coming in with climate as the main benefit and everything else that might matter to them as a co-benefit can be experienced as one more time where they're at the margins and some other issue is at the center. So we were cautious about inventing another word. There's enough jargon in the world for sure, but this one works better. Multisolving works better for me. I also like it that it's a verb. It's something we do together instead of an outcome that might or might not happen. Co-benefit is kind of a result. Multisolving can be an approach.
Yeah. Good, excellent. And we're tending to use the term multiple benefits much more, which is kind of moving towards the same approach. Mm-hmm. I want to deal with address some of the other questions in the chat. One is from Howie Frumpkin about cities, making this really important point that although we often talk about cities and we focus on them, rural stakeholders in many places are politically and socially conservative, and they often, at least in some countries, have disproportionate political clout, and they may resist the kinds of transformation that we're discussing, sometimes see it as a threat to their way of living. How can we actually acknowledge and integrate these rural perspectives more effectively into our thinking? Maybe, Arunabha, I'll hand that one to you to start with.
I'm not sure I understand the question, but I'm not sure I can generalize or agree with the generalization embedded in it or implicit in it. I think, this is where we have to go beyond, what is it a health issue we are dealing with, or the climate issue we're dealing with, or some other development issue we are dealing with. And this again goes back to the point about co-benefits versus multiple benefits or something else, right? If I take rural India, one of the biggest health interventions is actually access to cleaner cooking fuel. Right? Mm-hmm. Now, is that a climate-induced action? That's not how the policy was framed. Is that a health-induced action? That's not how it was framed. It was actually a gender-induced action with very clear electoral benefits, which then had immediate health co-benefits and maybe more medium-term climate co-benefits. So I think the general point which I agree with in the question is that whether it's urban or whether it's rural or peri-urban or whatever it is, there will be points of conservatism, meaning that there are certain issues on which people would be less willing to budge. And there might be other issues on which they might be more willing to budge. So we have to find those issues which can sort of grease the wheels of the change that we are seeking. And again, this goes back to the point I made in answer to your very first question, that it is important to include the frontline workers in your initial intervention design, because they will be able to help understand what entry point works and what will not work.
Yeah. These are great points. I think, the conclusion for the Commission then must be that the benefits that have the most traction in a given context should be the ones that are probably emphasized in trying to sell if you like, a particular policy. And those perceptions can often be best understood by consulting with the community that's going to experience the changes. And sometimes, of course, it may be the policymakers, but also those people who are actually going to intentionally benefit from the changes will know what arguments they find most compelling, I guess. Thank you.
One sentence, Andy, is that okay?
Yeah.
When we listened to Multisolvers and took their advice to design the Flower app, the second thing they told us was, let us describe what the needs are. So Flower actually has two parts. One is about showing benefits. The other part is identifying needs. And then each potential action is scored for how well the benefits match with what the community said the needs were. So just to reinforce starting there.
Great, thanks. I'm going to move on to another question from Kathy Wateki, who's really leading us into the next session, if you like. But the next session will focus on metrics, and if as you suggest, Beth, we focus the roadmap more on equity, building community shared values, what measurement frameworks would help to drive systems change in your view?
One thing we find is that the people doing the most innovative multi-solving often tell us they're extremely confused about the change that they're creating. And that surprises us because from the outside, we see they're building amazing new relationships. People are thinking in new ways. But they have been taught, all of us have been taught, that change is something we do only by ourselves. And if it was, multiple actors, we can't really somehow claim credit for it. And also that change must be like direct instead of what we know is true in complex systems, that it's complicated, it's nonlinear, it is often delayed. So I wish I could tell you, and therefore there's 3 simple things to do. And I'm not sure that that is true. But the first thing is educating people about what change will look like in a complex system, and realizing that if you've created, you can't multi-solve without creating new networks of relationships. And when you do that, you increase the adaptive capacity of a system. Again and again, what we see is, the bike path got built. That was amazing. But then the earthquake came, and because people knew each other, they responded differently. So even just measuring the new relationships that have been forged and the new ways of thinking, those are going to be some of the earliest indicators of moving in the right direction.
Thank you. Arunabha, did you want to add anything at this stage about metrics? No. In that case, I'll move on to a question from Jonathan Patz about the unprecedented threats to policies in the US. What are your thoughts on the priorities of communicating to the public versus policymakers? Of course, he says we must target both. but should we change our focus in the light of the unprecedented threats in the US situation? I don't know to what extent. Of course, these threats may also be echoed in other countries as well. In fact, they are being echoed in other countries, certainly in parts of Europe and elsewhere. So your thoughts about communication, the public, policymakers, the balance? Arunabha, do you want to start with that one?
Well, let me take a stab. It's a very thoughtful question, Jonathan. You know, I heard somewhere recently you can choose your public representative, but you can't choose your public. And I think this is a challenge we face, and this goes back to your earlier point, Andrew, about misinformation, disinformation. I don't think there is an easy answer there. Do we target the policymaker and make them more informed, or do we target the public to make them more informed? I think what is not changing is that the basic premise of electoral politics remains, which is that I will defer to what I think is the majority opinion. And by deferring to it, if I did some action and it yielded the expected results, that majority will vote me back in. If you accept that premise, then the theory of change here will have to be either convince the majority of your opinion, or you convince the policymaker that the majority has that opinion. So I think that is more tactical than just strategic. And I think, again, we tend to make the mistake of sometimes having very grand theories of change and missing out on potential allies that we can find, even in quarters that we feel otherwise where the doors might be closed to us. I don't think I can get into detailed stories on this, but I have had some such experiences, and I think we sometimes underestimate the ability of those we think were very different views to us of being convinced. But the nature of the conversation and the trust in the person with whom they are having that conversation matters a lot.
Thank you. Beth, do you want to add anything to that point?
Yeah, I would add that working with multi-solvers has taught us that multi-solving is a way of being and acting that is accessible to us no matter what is going on, caring about the well-being of others, looking for connections, prioritizing your strategy about building trusting relationships and centering equity. So you can do that in the midst of emergencies. And in the US, there's so much need and so much emergency, whether it's climate impacts or just these big gulfs of support systems that have been purposefully disassembled. And so we can meet immediate needs in ways that also are going to steer toward the future that we're trying to work for. And to make that less abstract, you can show up with portable solar panels and electric school buses in the site of a climate disaster to provide what people need in refrigeration and food and so on. So I don't think we have this either or. I don't think there are as many either or choices as it might seem. And it's more, what are your values? Are you going to act in a way that's consistent with complex systems? And then you can be talking at the highest levels or at the neighborhood level and going in the right direction in either case. I'm not hearing you, Andy.
I muted myself. I want to move on to another couple of questions in the chat. First of all, one from Noah, which really goes back to a point that Beth, you may, but I think actually Arunabha also may have referred to it as well. And that is, how do we build the capacity for systems thinking? Because most of us are brought up in fairly narrow disciplinary silos. And, in fact, the pressure at the moment is certainly in the medical profession, it's certainly in some countries anyway, is hyper-specialization. There is a counter pressure as well towards more comprehensive primary care systems, but often the hyper-specialization is the more dominant of the two because it's commercially more, it produces higher returns on investments and so on. And focusing on micro-level questions. So how do we actually create people? It's not to say people shouldn't be specialists. They should be specialists, but they should also have, well, they could be specialists, but they should also have this kind of ability to look across different systems and see how the whole system functions together. And that's arguably is something we're not communicating very well, certainly in health training, and I guess in other scientific and other humanities and other disciplines as well. So could you share your views on that and how the Commission might address that issue? And I'll start perhaps with you, Arunabha, and then move on to Ben.
Sure. I think there are two ways to do this. One, of course, is the more interdisciplinary approach towards systems thinking that I think Beth is also referring to, and we need to do that as academics and researchers, breaking out of our disciplinary silos, and we need to do that with more. Reaching out to other institutions. The climate people reaching out to the health people reaching out to the finance people, and so forth. That's one thing. But one of the things we've been trying out actually at CEW is now taking a lot of the systems thinking work that we've done over the years and now actually taking it to the lower level of bureaucracy. Because that's where the proverbial rubber hits the road. Let me illustrate this very concretely. We have about 740 odd districts in India, over 4,500 sub-districts in the country. We are developing a high-resolution climate resilience atlas. So we know district by district or sub-district by sub-district how heat or precipitation, etc., is changing. At the same time, we've also mapped out, using about 50 odd indicators, how those same districts their health systems are vulnerable to a changing climate. Now, if I take these two different bits, one sort of climate-related stuff and one health-related stuff, and bring it together, who's my audience? My audience is the district administrator. The district administrator, say in charge of about 5 million people, is dealing with schools, is dealing with the health facilities, is dealing with a sudden flash flood, is dealing with a drought, etc., with limited budgets. So actually the systems thinking is really about systems doing. They are having to deal with those multiple systems literally almost on a daily basis, but might not be given that superstructure or that capstone name of systems thinking. But if we work with them on what actually do they do on a day-to-day basis, what is the process flow, who do they assign when they need to respond to a crisis, or what could they do to avoid a different kind of crisis, we see that this might be one way to integrate what might otherwise be a very abstract approach towards systems thinking to a more, maybe imperfect, but more real approach towards systems doing.
That's a great lesson. And Beth, let me move to you.
Yeah, I think very similar thoughts from me. I actually am of the belief that systems thinking is our birthright and systems doing. We are complex systems. Our families, our organizations, our cells are all complex systems. We actually have a systems intuition, and most of us have been taught to distrust it. And the systems we have to move through create so many boundaries and borders and fractures that it kind of disorients our, I think, fundamental human ability to see things as wholes. So I think a big part of what helps is just to affirm to people that their instinct to see the whole and care about the whole, they can trust that. That was one of my main reasons for writing my book, Multisolving, which is a lot about systems thinking too, was to help people realize they were part of what I call a hidden movement. Around the world, people are responding to the dangers of this moment by seeing whole systems and acting in them. And they might need a formal language, and I aimed to give a little bit of some of the words that are useful in my book, but I actually think it's a human way of knowing that we mostly just need to prioritize.
Okay, that's great. Well, thanks for two really, I think, thought-provoking and helpful responses to that really important question. Let me move on also to another question from Howie Frumkin about, this is directed initially to you, Beth. The emphasis on relationship formation is very compelling. And I think you also made this point, Arunabha, in your most recent response. How does the huge contemporary role of social media affect how this is accomplished? And of course, this also takes us back to mis and disinformation as well. But so your comments on social media and how it affects us.
Well, I think it's complicated. I think the main thing I would say is I don't see it as black and white. Some people might say social media destroys relationships. I think it can actually be used to connect people and help them understand the world through another. And when major, some of the richest companies on the planet have kind of their finger on the scale of how those platforms work, then I think it tends to not foster that sense of community and connection. So I think in some ways, maybe the process is the same. I've never thought about this deeply, but what are the norms if you're in a room and you want to build relationships? Well, you listen, you tell the truth, you ask questions, you show up if someone else needs help. You can do all of those things in social media. It's just there's a lot of forces in the world that don't make the space for that.
Yeah, and I would say that, notwithstanding all the challenges, we also have to leverage the platforms, and whether it's online or offline, our confirmation biases are further confirmed by people we trust or less confirmed by people we don't trust. So we are constantly on the lookout for how to bring in trusted voices. One of the most recent things we've done in our outreach activities is something called India's Heat Wave Heroes. And we've basically used 5 YouTube influencers who have then gone out. So the influencers, therefore, they have large followings. They are not heat experts, health experts, climate experts. But they've then gone out to understand how are the frontline responders working. So I'm just putting in the chat the trailer to that series. It's 5 episodes that you'll find. But that's just one way we're trying to do this, using trusted voices to convey.
Great. And Vanessa Carey has also made the point that we often exist in information silos too. So sometimes bringing new information to groups that may not have heard it before can be accomplished on social media, and maybe we need to be more effective about doing that. But we are running out of time, but I want to ask you a couple of concluding questions before we draw this session to a close. One word that hasn't appeared very much, although I think it's been implied, is the whole issue of governance and how we create governance systems which can support health and equity within environmental boundaries. And part of that is the point we've already discussed, which is around sectoral silos, and sometimes easier to bridge at the local level. But I wonder whether you have any reflections about governance systems that you've come across that are particularly effective at allowing and facilitating decision makers to act in a systems thinking, transdisciplinary, intersectoral way. I don't know who would like to try that one first, but shall I turn to you, Beth, and then?
Sure, I could. I don't have a list of 3 places in the world I think are doing amazing at this. What I often find is that the appetite for the people within governance systems to do this type of relating and silo crossing is really high, and that often the obstacles seem to be coming from higher levels. So it's not in the job description, it's not in the budget, there's no time. Like, one of the biggest questions we get is, how do I make the case that I should meet with my counterpart in, climate if I'm in a health position, for instance. So I do think, because really what it comes down to, right, is that these solutions we're talking about are overall benefits for the entire system. And then there are parts of the system where they're experienced as a cost. And so to transcend that problem, you have to somehow have the thinking of the whole. And our governance systems don't have many places where that thinking of the whole resides. I mean, in a city, you can have community councils, or you could have a charismatic mayor who has the political capital to do it, I guess, and maybe a combination of the two. So I think we're still learning, and I wish I had more great examples to share.
And what I would add is that we are, at least in our approach, always looking for where in the existing governance systems can we embed, rather than trying to create new things altogether. For instance, India has this national program on climate change and human health. And then there are state action plans on climate change. Some have more direct health focus, some don't. So it's about bridging a national program with state action plans, etc., where we feel that because these are existing platforms, these have the administrative legitimacy, not just political legitimacy. There's some familiarity for the bureaucrat, and therefore there's potential to drive a new budgetary pathway within that. There's this the Rufus Miles rule, right? The way you stand depends on where you sit. So if you create a new seat, because a new initiative that we think is more rationally designed, it actually creates one more vested interest that's going to compete. So rather than create more competition, if we can have more coherence, that's a rule of thumb we are trying to pursue. Maybe not sufficiently disruptive, but it keeps the ball moving.
Thank you. And I just wonder in this context whether there's more we can learn from Indigenous ways of thinking and governing. I mean, we are, increasingly, the science community has not been very good, I would say, about interacting with Indigenous ways of thinking and Indigenous knowledge, but I think that is changing quite quickly. And I think many of us are becoming much more aware of how Indigenous ways of addressing some of these challenges at the community level can give us insights into how we might scale up some of these ideas, and also particularly the relationship between health and nature in many Indigenous communities. They're seen as inextricably linked. I remember talking to a colleague from the Maori community in New Zealand, and they said to me, don't talk to us about our health so much. Talk to us about the broader environment, which we see as actually part of our health. And they have, their own very clear cultural views of this, which in many ways may be more consistent with the kind of future that we're talking about than some of our modes of Western thinking. So I don't know whether you have any immediate responses to that, but it's certainly a reflection that I've had in recent times.
And that consciousness of environmental health, it also drives the nature of lifestyles. I think one of the things we are not discussing in the climate conversation sufficiently, or the health conversation, or the climate and health conversation, is lifestyles. At the end of the day, we cannot build as many solar panels and wind turbines and batteries we want.
Exactly.
As we choose to, walk a little bit more than drive an electric SUV instead of a gasoline SUV. And that consciousness comes more naturally to those who derive their personal health from the environmental health.
Yeah. Good. Well, look, I think I've now got to bring this to a close. I'm under very strict instructions not to go over. But I would like to thank you both for really, I think, a very rich discussion, which has illuminated, I think, many of the issues that the Commission needs to consider as it moves forward. So thank you so much for putting your own views so clearly, but also responding to a range of quite probing questions. And I think your responses will be recorded and will shape the thinking of the Commission. I won't try to summarise all the points that you've made, but just to say that I think we're all agreed that systems approaches are crucial. How to make them, how to implement them is the big question. We didn't talk so much about interest groups, or you warned us against vested interest, Arunabha, but there are certainly very powerful interest groups. And in the health sector, we've obviously have experience of the tobacco industry, the alcohol industry, and so on. And there are also very powerful forces at play here in the whole climate domain as well. So we need to think about whether some of the lessons from public health policies to address these very powerful interests can also be applied in the case of climate change. And the issue of myths and disinformation will be pervasive and will be something that we need to come back to. And of course, as both of you, I think, made the point that we also need to ensure that we can somehow integrate some of these ideas with current financial and economic policies, because these are what are often driving us towards an unsustainable future. And so we need to also think about the political economy of change. And that's something which we may try to tackle in some of our future meetings. So I will just call this to a brief halt now. We're going to have a break for 15 minutes. So if you could rejoin us at, here we go, 10:40 EDT, 4:40 for those of us in Central European time. Thank you again to both of our panelists very much. It's been a great start and you've given us a lot of food for thought. And also to those who put their questions in the chat for your active participation. Thank you very much indeed.